Hey guys, next step in the airway delivery system is going to be your BVM or bag valve mask. If we're going down the progressive airway scenario, this will be step or stage 3, I believe. So let's dive right in. So at this point, we're going to assess our patient again, PP as always. So we're going to determine a level of consciousness. So if the patient is unresponsive, they shouldn't respond to pain, they shouldn't respond to verbal, they should be tracking us, and we'll kind of go from there. So if the patient is unresponsive, we're going to check to see what they're responsive to. Sir. Patient is unresponsive. Now we're going to look, listen, feel. We're going to check their airway. So we're going to do that by utilizing the head tilt to chin lift. We're going to check the airway as well. At this point, we're also going to look, listen, feel. We're going to check for depth and effort for the respirations. So I don't hear anything, I don't feel anything. At this point, now we're going to check a carotid pulse for 5 seconds, but no more than 10 seconds. And if they have a carotid pulse, we're going to set up our BVM. And I will also request my ALS interceptor this time. So we're going to get our BVM, put the mask on. We're going to do what's called the E-C technique. C, and then E. So the C goes across the top of the mask with the nose, obviously going where the nose goes. And then middle ring and pinky finger are going to go kind of underneath the jaw to help keep the mask seated. We're going to deliver 2 quick rescue breaths. As we deliver our rescue breaths, we're looking for adequate chest rise, bilateral. And at this point, we're also going to connect our oxygen, which should already be set up from your prior stage. And we're going to set that to 15 liters or more. Your bag will also start to fill up at that time. We're going to do 1 breath every 5 to 6 seconds. So as we're bagging, we also need to consider rules of 2 providers, 2 adjuncts, 2 inches of elevation behind the head, 2 seconds, and 2 psi. And all the 2 psi means we're gently holding the mask to the patient's face. We're not trying to Hulk strength them or anything like that. It is nice, simple set, and we're still looking for adequate chest rise. This time, we'll switch over, I'll have my partner take over. So we're going to add padding behind the head. Also, if we have not done so already, we're going to get our patient hooked up to capnography. So after being adequately ventilated for about a minute or so, I'm going to have my partner step away, and we're going to do some simple airway adjuncts. For us, that is the MPA and the OPA. So checking gag reflex, we'll do an eyelash flutter. We're going to measure the NPA from tip of the ear, or the bottom of the ear, to the nair. This will be adequately lubricated. Again, checking your gag reflex. And with the bevel facing the septum, we're going to advance that. For the OPA, and a similar thing, we're going to measure from the corner of the mouth to the end of the ear. And there's 2 ways of doing this. I prefer the 90-degree technique. We open the airway, come in perpendicular, and then slide that in until you reach the back of the airway. You sometimes have to set this up a little bit better. That should be about the lip. The second way is the 180. So again, you're opening the airway, kind of guiding that in, and then as you advance, you turn the airway until it's seated at the back of the airway. And at this point, we'll reventilate. When placing your adjuncts, you shouldn't be, there shouldn't be more than 30 seconds of time between placing those and restarting your ventilation. And as always with your ventilations, make sure that you're looking for adequate chest rise both sides. We also want to listen to our lung sounds. Make sure that we're getting good oxygenation. So we want to listen both sides. Upper, upper, lower, lower. At this time, you can also go over your epigastric area as well. That's it.